Women normally ovulate once each month. Does that mean that there is only one day each month when you can get pregnant? What is the best day to attempt pregnancy? Stay tuned. Hi, I'm Dr. Randy Morris. I have been called YouTube's most trusted fertility expert. I am here to help you with tips on how to get pregnant faster. One of the keys to successfully conceiving a pregnancy is to have intercourse near the time of ovulation. It isn't necessary, however, to have intercourse exactly on the day of ovulation, although that works well. It turns out that sperm are able to live in the female reproductive tract for several days. Eggs, on the other hand, have a very short lifespan of only about 1 day. So what does this mean when you're trying to get pregnant? If you have intercourse a few or even several days before ovulation, the sperm can survive inside the woman's body and still fertilize the egg and produce a pregnancy. Studies show that having intercourse 5 or even 6 days before ovulation can still produce a pregnancy. But that far out, it's not very efficient. If you have intercourse 3 or 4 days before ovulation, your chances are better. If you have intercourse 1 or 2 days before ovulation, or on the day of ovulation, that's when your chances for pregnancy are at their highest. What if you only have intercourse after ovulation has already occurred? Studies show that the chances for pregnancy are very small, maybe close to 0. This is because the egg does not survive long after being released from the ovary. As you can see, knowing when ovulation is going to happen is an advantage when trying to become pregnant. There are many ways you can determine when ovulation will occur. Watch this playlist to learn about predicting ovulation. What if you aren't sure when ovulation is happening? When should you have intercourse in that situation? How often should you have intercourse? There are a few different possibilities here. You could have intercourse every day, but honestly, that's very stressful for most couples. Studies show that having intercourse every day does not improve your chances of becoming pregnant compared to having intercourse less often. Since we know that sperm can live for several days inside a woman's body, and since we also know that your best chances for getting pregnant are over a 3-day window ending on the day of ovulation, then having intercourse every 2 to 3 days should still maximize your chances of getting pregnant. If that still seems like more intercourse than you and your partner can handle, you can narrow down the time of ovulation with this trick. Count the number of days from the first day of your period until the next period starts. For most people, this is going to be somewhere between 26 and 32 days. Subtract 14 from that number. This is a pretty good approximation of when you might be ovulating. Just to be safe, start having intercourse 3 or 4 days before that. Continue having intercourse every 2 to 3 days, at least 2 more times. By using this trick, you will make sure that you have a high chance for pregnancy over a very wide range of possible ovulation days. Infertility TV is your most trusted source for accurate information on infertility and miscarriage. If you are not a subscriber yet, hit the subscribe button right now. A new episode is released every week. Don't miss any episodes. You can also check us out on our website, ivf1.com, where you can become a patient.